So Angela is going to give us a little bit about her story. We were talking about dislocation, and part of the reason that we brought you in is you have an unofficial diagnosis, although it's pretty official, of
Ehlers Danlos syndrome.
Okay, and how did you come to that diagnosis?
Like the whole story?
The whole story,
okay.
Yes, because this is 100% relevant for them, for the patients they're going to see in the future, things that they have to work around.
When I was about 5 years old, my knee dislocated in the back of my dad's truck, like in the back seat. My foot got caught in like some chains or something. My dad's worked in construction at the time.
Yep.
And so the movement of leaving the vehicle and my foot staying there, my patella kind of like stayed and the rest of me went.
Okay, so exactly. So when we're talking knee dislocation, we're not talking patellar dislocation. We're talking your tibia came out of place,
Yes.
right?
Yeah.
Okay, so that's a substantial injury right there.
Yeah. And that was like the first time any kind of injury like that had happened. That's kind of when our family kind of realized that my body was a little bit different.
Yep.
Yeah. So after that, we started realizing that like my hips would start to dislocate at times.
Okay,
like,
describe that so that they can recognize if a patient comes in and says my hips dislocate. What does that actually mean for you?
For me, full dislocation would be one time I was sitting on a swing and trying to adjust, and then my right hip dislocated.
Okay.
Fully.
Yeah.
And I had to get my mom to help me out of the swing and then lay me down on the ground. And I had to lay down on the ground for like, typically with my dislocations, it takes like 45 minutes to an hour for my, like the muscles and everything to relax for me to be able to push it back into place.
Okay, that is huge right there to realize that, okay? A full dislocation means, so if we're talking about acetabulo-femoral joint, I can ask for the 4 ligaments that hold the femur in place. What are those 4 ligaments again? Iliofemoral, pubofemoral, ischiofemoral, and ligamentum teres. So all 4 of those ligaments would be slack and relaxed and allow that joint to pop out. It's interesting that it would go back in on its own though after about 45 minutes.
There was one time where it didn't go back in on its own, and I had to have a chiropractor come in and pop it back in for me.
Yeah, and what did they do?
I was on a table like this, and I was on my side and had like the leg over, and I think she pushed it in.
Okay.
That way.
Yep. Either way, I've done it. I've done it before. You actually do it with a long axis traction, a little bit of rotation. You feel it get over the edge of the acetabulum, and then it slides back into place. So, okay.
Yeah.
All right.
I've had my knees have dislocated probably about 5 to 10 times each on each side. Hips have been about 3 to 4 times. My shoulders have dislocated, and I've popped back in myself.
So when you dislocate your shoulders, what kind of activities are you doing that causes them to dislocate?
The thing is, it's never after like a vigorous activity, like I was running a marathon and then I had an injury. It's just day-to-day activities.
Yeah. So it's like typically you see it in the literature. It's a sudden unguarded movement, right? You just moved. Maybe the muscles weren't contracting quite right. You don't even know what it was, but it was just the right degree of angles and everything like that. That boom, it just popped out. Yeah.
Yeah.
All right. So when you put the shoulders back in, how do you do that?
It only happened once.
Okay.
And it's a few years ago, so I don't remember exactly.
Okay, that's all right.
I think I remember like pulling and then like.
Yep, but exactly. The motion you described is pretty typical of what
Yeah.
you described, right? As it came down and it came around
Yeah.
and it came back into position. All right.
Pretty much everything's like popped and dislocated. In general, things will kind of like shift out of place.
Yep.
And I'll have to like stretch and then like kind of crack it back into place.
Yep.
So hips, knees,
Back.
elbows, shoulders, back,
Yeah.
ankles,
Anything in the neck at all or not?
neck,
Yeah.
knuckles on my hands and feet.
Yeah.
Like my neck is very tight. Like for a while I thought there were like extra bones there.
Okay, but exactly, okay, but this is what regular patients will think. They feel like there's extra bones, all right? There actually could be potentially there's anatomical variation, but maybe, okay? All right?
So.
Yeah, but exactly, okay? All right, so one thing I want to talk about just on that topic really quick, that is the body's protective mechanism there. Those muscles are being tight to make up for the ligament laxity to maintain stability of those joints, okay? What happens is you get fatigued, you move in a certain way where the muscles didn't fire quite right, that's when we see dislocations taking place. So one thing I want to caution you guys on, if we're going to do any kind of soft tissue mobilization therapies, it might not be in your best interest to have her muscles more relaxed and more flexible or anything like that. This might be a patient where I'm going to work to more stabilization and muscle strengthening. Now when you first came in, Angela, one of the things I asked you was, do you work out? And you said, well, maybe a little bit, but not, I did it once upon a time, but not so much, right? But one of those things, increasing muscle strength in a safe range could help reduce some of the risk factors that you see with this. Like how did you actually come to the official diagnosis? So history of dislocations for sure?
I'd always been referred to different specialists throughout my life, so I went to a geneticist. No, I didn't go to a geneticist, sorry. I went to about 3 or 4 different rheumatologists to see if I had like arthritis or some form of that. It always was negative. There's never like, I would always go to different specialists and there would never be
a confirmatory answer.
Nothing. Yeah, they would never have an idea what was going on.
Yeah.
And then I finally got an appointment with a geneticist, and then I got a probable diagnosis for EDS.
Okay, what is EDS, sorry?
Ehlers-Danlos syndrome.
Okay, Ehlers-Danlos syndrome. It's named after the physicians who discovered or first coined it, coined the name. All right, so what are some things, why do you have a probable and not official diagnosis?
Because it's a very rare disease, so they only diagnose extreme cases of it. So an extreme case, there's about 4 different stages of it, or types of it. And the most extreme is when it affects the veins around the blood vessels in your heart.
For sure.
Is that correct?
Yeah, you're absolutely right. So just wait, one thing I want to impress upon you guys as well is, so Angela's, she's researched this condition. How old are you?
I'm 20.
You're 20. She's 20 years old, and she would know as much as many physicians and healthcare providers about that. So do not discount the knowledge that patients bring in with them.